Dr. Smart, how are you today?
I'm good, guys. Thanks for having me.
All right, thanks for coming on as always. It's our weekly SOS house call, and I guess let's start in the NFL. And we saw last night DeMarvion Overshown suffer what looked to be a serious injury. The reports are saying that it's more than a torn ACL. Can you explain what that means? What else could you do that would make that a more significant injury other than just quote unquote tearing your ACL?
Yeah, you can hurt a lot of the other ligaments in the knee. I mean, with an ACL tear, frequently you'll tear a meniscus, which are like the shock absorbers inside the knee. And then the other big ligament that can get hurt is the MCL. So we actually refer to that as the terrible triad in orthopedic surgery, where you tear your ACL, MCL, and your meniscus. So you can hurt lots of other things. It just depends on how much force goes through the knee.
All right, let's stay in the NFL. Panthers running back Jonathan Brooks left Sunday's game against the Eagles with what was initially described as knee pain. The team has now confirmed that it is a torn ACL, right knee, same injury that he had 13 months ago when he was in college. Does him suffering that same injury to the same knee, does that impact now the rehab process, or is it the same rehab that he just went through?
It's the same rehab, but it certainly impacts it. And I'm assuming in college he had it fixed. I mean, usually he would have a reconstruction done then. So if he's actually re-torn the reconstructed ACL, it's tough because then you go in, you have to redo it, redo everything. Sometimes you can have more damage. You fix that. Sometimes you'll add on some other procedures with it to try to regain stability, because it's like, well, why did it re-tear? You know, you have other factors. So that's tougher. I mean, anytime it's a revision, it's less predictable. And achieving that ultimate return to play and being good can be tougher to get there.
Would you treat the rehab or the comeback, I guess, any differently the second time around than you would the first time around?
I would go slower. You know, with him just hitting his benchmarks. You know, we have milestones when you recover from an ACL of when you're allowed to run again, when you're allowed to plant, cut, and pivot again, depending on the instability in the knee. And a lot of it will depend on what the surgeon feels like, you know, exam and during surgery. But if he's got a pretty unstable knee and you're asking that ACL and whatever else you have to fix to do a lot, I'd go a little bit slower with the ultimate return to play.
All right, let's go to the NBA now. And in last night's Knicks win, Raptor star Scottie Barnes suffered what I guess turned out to be a sprained right ankle, but some had feared it was more serious than that. I guess he told trainers that he couldn't feel his foot as part of the injury. In general, what could cause something like that for, you know, an athlete to say they lost feeling because of an injury?
That with ankle sprains, that's actually not that uncommon. There's some nerves, superficial nerves that go right to the foot, the top of the foot, and the mechanism of the sprain, you know, we've all seen it when somebody lands and the foot turns in. You quickly stretch those nerves, and if they get hit hard enough, the foot can feel numb. The good news is that totally recovers, and it's basically an ankle sprain that you don't really treat any differently.
So I was going to say, that's not any sort of indication that the injury is more serious? Like if he has that symptom, that doesn't speak to the severity of the injury?
No, it certainly tells that, again, that ankle got torqued pretty hard if the nerves then got involved. But it really wouldn't change kind of the overall treatment typically. It would still be treated as an ankle sprain, which you let the ligaments heal, recover. That nerve typically recovers. So it doesn't add much else to it.
All right, staying with the NBA, there's an injury analyst out there, Jeff Stotts, who has found that this season there's been a 35% increase in games missed in the first 3 weeks of the season compared to last season. Do you have any ideas, any speculation? Like, I know players are more apt to, you know, pick rest over playing with an injury per se, but is there any reason why the number would be that high from last year to this year, 35%, and the fact that, you know, more players are dealing with injuries and specifically lower body injuries? What would be the reason for that?
Yeah, I mean, again, I'm just speculating, but I think you hit the nail on the head. I think years ago, and I'm kind of an 1980s, 1990s kid, I think athletes back then just played through stuff so much more than they do nowadays. So I do think it's a little bit of that. I also wonder if it's an accounting thing. I mean, are they just documenting more of these injuries where guys in the past just played through them and maybe not even verbalized them. And then I think the last thing is, and again, my sport's kind of ice hockey, but I marvel at how fast. Everybody's just bigger, faster, and stronger. And as we all move faster in our bodies, you can be prone to more injury just from jumping higher, being more explosive, all of that. So I think it's a little bit of all three of those things would be my best guess.
All right, Dr. Ryan Smart, thank you so much for the time as always. We appreciate the insight. Enjoy the rest of your week.
Thanks, guys. And I definitely got smarter with the 3 dog nights. So I appreciate that.
Thanks.
Nugget from Paulie. Talk to you soon. That's our weekly SOS house call. Dr. Ryan Smart joining us here. And with that, we'll hit a timeout. We've got Tommy Valentine from News 10 in Albany coming up at 1 o'clock to preview tonight's game. Bryce Gelman, 1:30. We can mix in your phone calls the rest of the way throughout as well. Back after this on ESPN Radio.